Hello, everybody. Welcome back. Today, we are going to be doing chapter 2 of the Align Your Health book. Now, if you are a current client and you did not get this book when you started care, please leave a comment or contact the office and we will set one aside for you and you can pick that up at your next appointment. Now, if you're a family member of a client or you're just happen to see this or a friend, then also please contact the office and we will get you one. 779-423-2044 is our phone number. Just call that number. Anybody that picks up the phone will be able to assist you in getting a book sent out to you, and so that you can follow along and read this for yourself. Now, today, going over chapter 2, it is entitled Shifting Your Perspective. And in a sense, we are going to be talking about the difference in philosophy between chiropractic philosophy or a vitalistic viewpoint versus a mechanistic viewpoint or allopathic. Now, something that he says later on in the chapter, but I do think it's important to mention early on page 29, he talks about how max living is not a replacement for medicine. And I think that's quite obvious that chiropractic is not a replacement for medicine. However, one thing that we will touch on and talk about, but is when you start to take responsibility for your health and you start to actively do things that are going to add to your health, you will notice that your body functions better. And when your body functions better, you don't have the same feelings that you had in your body. You don't have as much disease, you don't have as much inflammation, you're going to notice that you're at a higher level of health and you'll need less of those interventions on the medical side if you're taking more responsibility for your health. So let's jump back into the beginning of the chapter here, where it starts on page 21. And one of the first things that he does is he gives the definition of health from the World Health Organization. Now, something that the World Health Organization outlined back as far as 1948 was that health is not merely an absence of disease or symptoms, but it is a state of complete physical, mental, and emotional and social well-being, and not just the mere absence of symptoms, which I think is a lot of people's definition of health these days is that, well, I woke up and I'm breathing and I'm not sick, I'm not coughing, I'm not sneezing, and therefore I am healthy. Now, you talk to someone who has had a heart attack and you ask them, how did you feel 2 days before you had the heart attack? They're going to tell you, I felt fine. Most people, when they find out they have cancer, if it wasn't a preliminary screening, when they find out, it's from some sort of pain or symptom. And when they find out, more times than not, it's stage 4. And depending on how where it is and how severe it is, prognosis can be anywhere between 6 weeks and 6 months. So obviously, using the barometer of how you feel is not a good gauge of health. Okay. So you need to be actively working on your health and doing things that are going to add to it, and not just merely gauging your health on the fact that you don't have symptoms, you're not sick. But we're going to, obviously continue to touch on that as we talk a little bit more about the chiropractic philosophy here. So something Dr. BJ mentions on the next page, page 22, is that whether you've identified this or not, you do have a philosophy on health, and you have made this an example or exemplified this through your beliefs and through the decisions that you've made, because ultimately your philosophy is going to lead to your actions, and your actions are going to lead to outcomes which are dictated by your beliefs in health. Does that make sense? So whatever it is that you believe on health is what you are going to do day to day, and is going to get you the exact outcome that you've got in your life today or now. Now, something else that Dr. BJ has talked about in this is that we talked about mechanism versus vitalism. Now, the mechanistic view is going to be more allopathic and treating disease and repairing and being reactive. Where coming from a chiropractic standpoint, you want to be more proactive with your health. And why wait for a problem to develop to do something about it? If you knew 10 years from now that you were going to have excruciating low back pain, would you wait 9.5 or 10 years to get it, to do something about it? Or would you start doing something about that today in order to get ahead of that curve and make sure that you don't have those issues? And when you phrase it like that, it's rather obvious. I think that everybody would say, yeah, I'm going to do something proactively, but we don't know, right? So the thing is why wait? Why wait for a problem to come about and be reactive to that when you can do something about it today, now, and when you're feeling good? Because I can tell you, it's a lot harder to get you back to where you were once you have gotten a disease or gotten in pain than it is to take you where you're at now when you're not in any discomfort or not having that symptom and get you to a higher level of health. And in fact, that's one of the things that I love about chiropractic is that I can take somebody who will come in and say, hey, I'm not having any pain. I feel great. And I can say, well, great, let's make your body function better. Let's get you to another level of health. Let's get you to a higher level of health. And they always leave feeling better. In fact, one of the things that I always say to patients that when they come in is they jump up and they say, always better after. So yeah, it's like a bath for your insides. Don't you just feel better after an adjustment? And you always feel better after adjustment. But the thing about it is not only that you're feeling better, but your body's functioning at a higher level. Your body's healing at a higher level post adjustment. So that's also another beautiful thing is that when a person comes off the table, I can say, you are healthier now than when you walked in the door. And, not many professions can say that. Try going to another healthcare professional and saying, I feel good, but get me to a higher level of health. And I can tell you, there's only a handful of health professions that can do that can take you when you're already in a great level of health and get you to a higher level or get you feeling better. Okay. So let's keep moving here. The next source or the next page on page 24, Dr. BJ is talking about sources of interference. Now, if you're a chiropractic patient, you know that, interference is something that we talk about quite often, but most commonly we talk about it interference within your spine and within your nervous system. There's also, which would count as a physical, but there's also an emotional and a chemical component to those stresses as well. So Dr. BJ on page 24 first dives into the physical aspect. Now, quite obviously, we have the physical stresses from our jobs, whether it's a physical job or not, whether it's construction or whether you sit at a desk, your body takes abuse. Now, most commonly with people who sit are going to be things like upper back and lower neck pain, right arm, low back. It can be the same if you have a very physical job, low back, neck, shoulder from carrying things. But it doesn't matter what your job is, it's going to be physically demanding on your body. And often that we found that most jobs today in some regard are very repetitive. Now, the repetitive stress is going to add up and make cumulative effect and cause you wear and tear in your body. And so you have to do things, you have to do something about it preemptively if you want to be able to continue to do that at a high level and move at a high level. But, beyond those obvious physical stressors are things such as poor posture, which are going to, lead to things that are going to, like injuries, leave you more prone to having injuries and a sedentary lifestyle. Because if, you have bad posture over time, it leaves you more apt to get injured. Then when you're injured, you become less physical, or you have less physicality to your day, so you do tend to sit around a little bit more, which is going to just lead to a cascade of bad health effects. Poor breathing, which is going to lead to less oxygen. I think you understand where I'm saying. So taking care of yourself, not only but physically, is going to be the first component of good health and making sure that you're moving that interference. Now, next we talk about chemical stress. So these are going to be things that you might think of as alcohol or, even some of the other chemical components, toxins such as, the things that we clean our houses with, or the things that we spray on our body, or, our personal hygiene products that we use, all very toxic, all forms of interference. And, one of the key one on page 25, one thing that Dr. BJ does say here is that a key facet of the Western Methodistic philosophy of health is that it attempts to heal the body with chemical adjustments rather than address the cause of the problem. We're just trying to address the symptoms of the disease. So we should not only think about the intervention, but the philosophy behind the intervention that we're also choosing. Because you can use anything in an allopathic manner. You can use chiropractic in an allopathic manner if you come in just for pain, rather than using all of the health benefits that you can get from it and having a holistic mindset upon that. Now, the last one is emotional stress. Most emotional stress is going to be displayed in some sort of hormone imbalance. So whether it's, an abusive relationship, extra stress at work, depression, anxiety, it almost always, when it shows a symptom, shows up as some sort of hormone imbalance, because your body's constantly in a fight or flight mode, or you are constantly putting out too much stress hormone and cortisol, which can lead to, other health ailments too, such as, diabetes and, on and on. So removing those interferences from your body is going to be key. First, identifying them so that you can remove them, and then, figuring out the best way for you to remove those interferences. Now, one of the things that Dr. B.J. Palmer has said years and years ago, who was the developer of chiropractic, is he talked about the difference between, when he talked about medicine and chiropractic, he said, medicine is the study of disease and what causes man to die, where chiropractic is the study of health and what causes man to live. A very fundamental difference. And when you hear it put that way, it's obvious that you would want to be on the side that's going to study health and life and want you to thrive, but it's often not thought of like that. So just becoming a little bit more of a shift in mindset toward that holistic and that vitalistic mindset and not compartmentalizing the body into thinking, well, I have a heart issue, it's just a heart problem, or I have, a problem with my stomach, it's just a problem with my gut. It really is a holistic, the body is greater than the sum of the parts, okay? Finishing up here, moving on to the next page, talks about a lifestyle change. Now, when you first become a patient, we talk about, making small incremental change, because, often taking on too much at one time will set a person up for failure. And so when you're going through and you are going to start making these changes and start living a healthier life, be sure to just do that in small increments. And so we talk about this when you first starting getting with care, or when we do shop with the doc, or any of our other events. It's about making 1 or 2 changes at a time. And yes, you can work on multiple areas at one time, but like I said, often biting off much more than you can chew is often a recipe for disaster. So I hope you guys have enjoyed this video and got something out of it. This completes part 1 of the book, and we're now going to start to dive into part 2 as of next week. The very first chapter that we're going to get into is called Chiropractic at its Core. So we are going to be talking a little bit more in depth about chiropractic itself before we start to dive into some of those other essentials. Reason being is because if your body is not functioning properly and you are trying to eat healthy, how well can your body assimilate the nutrients if your stomach doesn't work? How well can your body lose weight if the nerves going to your autonomic nervous system and coming from your brain to your body, how well are you going to be able to perform those exercises? And how well is your body going to be communicating to go through the proper processes for you to lose weight if your spine and your nervous system aren't in alignment? It all starts with your brain and your spinal cord, and that's why your brain and your spinal cord are the only thing protected by bones. So we're going to talk more about that next week, guys. Again, if you want a book, 779-423-2044, and we will get you one. Have a great day, and God bless.